Welcome to one of our live sessions. If you've been here before, welcome back. Will be this section has two components, lamina propria and plus epithelium, okay? Because when you have extrinsic muscles that come from the outside, they change the direction of the tongue to talk, to roll your tongue, bundles like these. So you draw bundles of collagen running this way. Here inside, you have the marrow cavity. And here, this part is called the trabecular bone. This is not in the entire bone, okay? Not throughout, okay?
Do you enjoy learning without distractions? Download our app now.
Welcome to one of our live sessions. If you've been here before, welcome back. We've got a few messages from people saying what to write in histology when it comes to an examination is quite a mind-boggling thing for most students. So I thought maybe we picked out some very recurring short note, long essay questions from histology, and we've handpicked them. So today, this is not really, I'm not going to teach anatomy like histology itself, but what this session is going to focus on is mainly how to approach a particular question when you have an examination, okay? So the easiest way to teach histology is to just like draw and take it as we go. And then we will have a little bit of a revision session where I will show you an actual good illustrated image, so that you're not stuck with a possibly bad one that I draw, okay? But anyway, so I hope you can see my screen. Right. I'm going to start with histology of the tongue. And again, like I told you, I'm going to stick to important things that you need, that I as an invigilator, if I had to look at your paper, I would look for in your diagram and also in your answer sheet, okay? And we'll stick to that so that we finish the session. Right. Okay, we're going to start. I hope you can. Another thing I must tell you is learning is such a continuous process, In all these years, this is the very first time in my life that I'm drawing on a histology diagram on an iPad. Okay, so bear with me. Okay, so before we start with the histology of the tongue, let me just tell you one. Okay, this is the tongue, right? Now, you already know basic gross things, that this is the sulcus terminalis, right? Or the terminal sulcus, which basically divides the tongue into a posterior 1/3 and an anterior 2/3. Okay. Now we know that. Now I'm not going to go into any gross details here, gross anatomy details, but under the microscope, if you have to look at a section of the tongue, what we see is, of course, the entire GI tract is lined by mucosa. Okay. Now, what is this mucosa? Mucosa is actually the lamina propria, which I'll explain, I'll draw and explain, plus the epithelium. Okay? This is like a formula, which if you remember, it'll be super easy for you. I don't know whether you have to study the rest of the GI tract right till the anal canal, but if you do, then just knowing this much will really help you, okay? And everywhere, this is how I remember it, everywhere I think how the epithelium changes as you go from the oral cavity down, right down. And a very easy way to remember that is just to understand what is the function of that particular part, okay? So when we come to the tongue, I've mentioned this before, the oral cavity is subjected to a lot of wear and tear, right? Because of food, drink, saliva being produced. Every time you talk, your tongue is hitting the sides of your mouth, the teeth, the roof, correct? So to have continuous production of epithelial cells, a multi-layered epithelium, let's have a back and forth, okay? I would like to have on chat box. I know even the last session we had quite a nice discussion. So if somebody could tell me what is most of the tongue epithelium? Okay, yes, stratified squamous epithelium. Okay, stratified meaning it's multi-layered, and squamous meaning as the cells go to the surface, they become flatter, and these flat cells are called squamous cells. Okay, now the one his microscopic difference, there are many, but the one key one that I'll mention here is that the anterior two-thirds of the tongue actually have papilla. Okay, what is papilla? We'll come to that. And the posterior two-thirds do not have it. Okay, now what is this papilla? The mucosa. Now, when we draw it, right, what we tend to do is you okay, say this is the tongue, and you tend to draw the mucosa and say, I've had a lot of students tell me this, that it goes down and it folds. But the fact is that the mucosa actually doesn't fold. What it does is the mucosa actually lifts. What do you mean by lifts? Elevates, correct? So what happens is that the mucosa lifts from the surface. Okay. Now, this lifting is, I'll draw the rest of the tongue. Yes. Okay, so what we are going to actually do here, if I go back to this slide, there are 4 different types of papillae. Okay, one of them is not actually very developed in humans, but the other 3 are. So right in front of the sulcus terminalis, you have the circumvallate papillae. Okay, this one is called the circumvallate. Can anybody tell me the most numerous tiny papillae on your tongue, which actually gives the rough texture on the surface of your tongue? Can anybody in the chat box tell me what those are called? Filiform, correct. Other than this, fewer but a decent number. What am I drawing here? Slightly bigger, mushroom-shaped, rounded top. This is, what is this papillae called? Filiform. What's the other one called? Fungiform, correct. Fungiform papillae. And the one right in front of the sulcus terminalis, arranged in a row, is called the circumvallate papilla. Okay. Now what am I going to do is, if I take a section like this of the tongue, that is from the dorsum, I cut it downwards this way, which means under the mucosa, I'm getting everything else, the actual substance of the tongue. Now, the actual substance of the tongue is very unique. Anybody can tell me why? Does it have bone? If I slice through the tongue like this, does it have bone? Yes? No? No. And it's made up of a very specialized type of, now you know the different types of muscle. What muscle will I find under the mucous lining of the tongue? What forms the actual substance of the tongue? Smooth muscles, or cardiac muscles, or skeletal muscles? Yes, okay. Skeletal muscles are found underneath, which means they are striated. Why is this? Because we know skeletal muscles are voluntary muscles. The movement of your tongue is 100% under your control, which is why the tongue is completely made up of skeletal or striated muscles. Okay. Now let's get straight into it. Now, if you want to draw the image like this of the tongue, what you will do is, if I take a section like this from the back, from that sulcus terminalis right towards the apex of the tongue, this is the shape that I will get. Okay, so this is the posterior end, or close to the sulcus terminalis, and this here is the apex of the tongue. Okay, now this side facing up is called the dorsum of the tongue, and the part facing down is called the ventral surface, right? Which is the under portion of the tongue, the inferior surface of the tongue. And the inferior surface of the tongue is actually attached to the floor of your mouth through the frenulum, okay? So that every time you either sleep or you lie back or you're talking or swallowing, You're not accidentally going to be swallowing your tongue, okay? There's also muscle action responsible here, but the frenulum keeps your tongue tied. Okay, now let's talk about, okay, now I told you that the mucosa, which will be this section, has two components, lamina propria and plus epithelium, okay? Now this lamina propria, actually, you know what it does? It kind of gets into the shape of the papillae, okay? Now, if you notice my diagram here, I have drawn, this is one, this is two. If you notice here, they are of different shapes, right? This one is pointed. Number one is pointed. Okay. This is your filiform papilla, very abundant on the surface of your tongue. Number two is the fungiform papilla. Okay. Fungiform because it's kind of like a mushroom. This is how I remember it. A mushroom is a fungus, right? They call it a fungi. So this is how I remember it. Now, what about the epithelium? We've already discussed that it's made up of stratified squamous epithelium, but both these, right, do not have the same epithelium. In fact, the filiform has a layer of dead tissue on top, dead cells, the cells that basically lose their nucleus. Can anybody tell me what that is? What that would be called? If I draw it like this? Let me give you a hint. It's also found in your skin. The two types of stratified squamous epithelium, right? One is keratinized, one is non-keratinized. So we have to remember that the filiform is actually keratinized and the fungiform is non-keratinized. Okay? Right? Yes, non-keratinized. Now, if you have to draw it, you have to draw this epithelium, right? So what will you do? First, stratified squamous epithelium, you already know this is all basic. It starts with a layer of columnar cells. Then we have 2 to 3 layers of polyhedral cells, polygonal cells. As they keep going to the surface, they get flatter. Then they become very flat and they become squamous cells. But these are not dead, all are alive. And all of them are different. They have different nuclear characteristics also. The nucleus is different, okay? So let's start with the columnar cells. Like I told you, please be a little forgiving with my artistic skills. This is why we hire really talented illustrators, you know. Okay, and today somebody was making a joke saying, ma'am, you've worked here for a year, but we've never seen you draw. So there's a reason for it, okay? Okay, so first we start with columnar cells. Then we have a few layers of polygonal cells. I'm not going to draw the entire thing. This is just for you to know what comes after what. And as you go above, you start flattening your cells like this, and then they get flatter. As I'll show you a better diagram, okay, later. Okay. They get flatter like this. Now let's put the nuclei, which is very, very, very important. Let's zoom in. Columnar cells have elongated nuclei because the cells are also elongated and they are closer to the basement membrane. Next, you have the polygonal cells, which have central nuclei like this. And as you go closer to the surface, when the cells become flatter, the nucleus will also become flatter. And these are the squamous cells. Okay. Now notice one thing. This is keratin. Okay. One important thing you need to know about the fungiform papillae. Now, why do we have these papillae? What within the papillae, within the core of the papilla, what do we have? Clue, special senses, taste buds. Thank you, Faisal. I like that you've unmuted yourself. That's amazing. Okay, so Yeah, so filiform papilla do not have these taste buds. Okay, remember, no taste buds. Which means this is a common mistake. I've also done it multiple times, is that blindly, as we are doing our record books, right, we keep on drawing this epithelium and finish it, and then realize, oh gosh, I should have drawn one taste bud there. Correct? So when you come, this epithelium has to continue, by the way. Here, I'm not going to do the entire thing. I'm just explaining bits and pieces to you. And in your exam, you put it together. I suggest when you do your, you will see multiple record book diagrams with like very massive, lots of filiform papillae, lots of fungiform papillae. But I would very strongly recommend draw one or two filiform papillae, one fungiform papilla, and if you want to draw a circumvallate papilla within the same diagram, you're welcome to do so, or you can draw it separately. But just stick to that much so that you complete your diagram, because this, let's face it, takes a while. Okay. Now we'll come to the fungiform papilla. Now, if I have to come here, what I will first do is first I will actually draw the taste bud. Okay. Now I will. This is just a like this rough diagram. When you are doing it for your in your epithelium, this much is enough. Okay, this portion should be removed actually. Okay, now these taste buds are elongated cells and with the central nucleus. Okay, little more in detail I will tell you now. Here also, yes, somebody said basal cells. Here also we have basal cells. You have to have basal cells in areas like stratified squamous epithelium, which the top layer keeps going off, right? If you don't have a basal cell layer, who is going to continuously make those cells to reach the top? Okay, so there you go. First, on your fungiform papillae, first draw your taste bud, and then you continue with the rest of the epithelium, which continues as the rest, stratified squamous epithelium. But here, guys, remember, this part has to be non-keratinized. All right, non-keratinized epithelium. So if now this is the lamina propria, this here that you see, lamina propria plus epithelium equals mucosa. We're done with the mucous lining. Now let's go deeper. What comes, okay, under this, we have a lot of connective tissue. One thing that is very, very, see, if you cut your tongue, right, most often when children fall, teething children fall, and it's very common in children, and also when talking, if you bite your tongue, not really badly, but if you just bite your tongue and it bleeds, most often it does not require stitches and things, right? Because this is one of the very great characteristic features of the tongue. And this ability to heal fast is because of an abundant blood supply. Okay. So, one thing that you have to draw as soon as you go to the next, after you finish your mucosa and everything, draw blood vessels. What am I doing here? Rounded, thicker wall is an artery, thinner, collapsed wall is a vein. Okay. You can have multiple veins also around an artery, not necessarily there has to be only one. So, number one, start with your epithelium, finish your taste buds, finish the papillae, go down deeper, draw some connective tissue like this. Okay. Then get down deeper, draw lots of blood vessels. Now, the main part is your muscles. Now, we have said that striated muscles. You already know that skeletal muscles are like tubular, like this, right? Okay, and where is the nucleus? The nucleus they're multinucleated, first of all, and the nuclei get pushed to the periphery, correct? Okay, now just think I cut a section here. And now I turn it around. So this is called a cross section. If I look at a cross section, each of these things will become like a bundle like this. See? This is a cross section of the muscles. Now, why do we see both in the tongue? Simple, because muscles of the tongue, we have extrinsic muscles, intrinsic muscles. This is gross anatomy. And they just run in all directions. Why? Because when you have extrinsic muscles that come from the outside, they change the direction of the tongue to talk, to roll your tongue, to swallow. It all changes the direction. But if you have muscles inside the tongue, intrinsic muscles, they cannot change direction of the tongue, but they can change the shape of the tongue, which means either, and some people can, muscles are very developed, they can do all kinds of weird things with their tongue, right? Just like roll it there itself and then make it like very concave, very convex, etc. Okay. So remember, extrinsic muscles change the position of your tongue. Intrinsic muscles change the shape of your tongue. Okay. So because all these muscles are running in various directions, you see both, and there is no pattern to it. Okay. You can just draw longitudinal muscles this way. Next to that, you can imagine if I have cut the tongue like that, some of it will look like this. But what is very important here to remember is don't forget your peripheral nuclei. Because if you do not put peripheral nuclei, I will assume, I mean your teacher might assume that you do not know what this is that you're drawing. Okay? So same thing here, fill it up. Don't put one rounded nucleus in the middle, okay? These are multinucleated nucleus at the periphery. Replicate this wherever you need in the tongue, okay? So we have drawn quite a few very crucial things that are required in the tongue. One thing we have not yet drawn are the glands, which is again a very, very important feature. Now, the glands are seromucous, okay? Serous glands, mucous glands. This is again basic histology, how to draw these glands, right? But anybody wants to unmute themselves and help me with this? Seromucous glands, anybody? Can you tell me how, if I want to draw a serous gland, how should I draw the cell? How do I draw the cell?
Pyramidal.
Two things you can remember. Yes, Rabia. Is that how I pronounce your name, Rabia?
Yes, ma'am.
Yes, Rabia. Tell me.
Pyramidal shape, ma'am.
Yes. So serous, pyramidal shape. So much so that if you notice here, this lumen is very small. Correct?
Yes.
Okay. What about mucous glands? Mucous glands have a larger lumen, see? So,
Fluffy nucleus.
yes, and the nucleus gets pushed to the periphery. Why? Because it's producing the mucus, right? It's the mucus that is pushing the nucleus towards the periphery. However, when you see under the microscope, right, you don't really see this. I mean, I don't think so, because I've never seen. They have a very empty kind of a look, because when you are processing your slides or when you're processing your tissue, this mucus kind of gets, removed. It gets washed away, and so you don't really see it. Which is why under the microscope they kind of look like empty spaces. Okay, so this is one thing that you have to draw: pyramidal cells with rounded nuclei. And then you draw. So these are your seromucous glands. Okay. This much if you draw. If you have the time, you can continue the epithelium here, which is ideally what you should do. It doesn't have papillae at the bottom, but it does have the same epithelium that continues. Okay. Basal cell with columnar cells, polyhedral cells, squamous cells, etc. And then you finish it. The rest of the time, rest of the thing, you can just put your skeletal muscles and more seromucous glands. Okay. Now, now we've spoken about two of these papillae, right? You know, a lot of people think that when you stick out your tongue and you see those bumps, a lot of people say, oh, those are taste buds. But actually, that's incorrect. Okay. If those are not taste buds, the elevations are called papillae, and the taste buds are in the inside within that. What is that? Papilla. Okay. Like this. Now, there's one papilla that we have not yet seen, this circumvallate papilla. Now, let's say this is your tongue here. Close to the apex, you see filiform, you see fungiform. Okay. Close to the sulcus terminalis, you will see larger, a nice large papilla like this. And this is called the circumvallate papillae. Okay. Now, the amazing thing about the circumvallate papilla is it has the same epithelium as the fungiform papilla, which is what? Non-keratinized stratified squamous epithelium. Okay. However, where are the taste buds here? Are they on top, just like the fungiform papillae? Where do you think the taste buds are? Anybody? Guys, right answer, wrong answer, doesn't matter at all, okay? I mean, I have failed enough anatomy exams until I actually took the subject seriously. Believe me, it has happened, and badly failed also. So, right. Okay, so now one interesting key feature here is that there is a deep groove between the two adjacent circumvallate papillae, okay? And that groove is also lined by the stratified squamous epithelium, okay? Which means you will draw it like this, okay? And these taste buds, right? They are here on these walls. All right. And then you continue with your columnar epithelium again. Okay? Nuclei, let's get the nuclei. All right. Now, the rest of it, you know, it has to continue just like how we spoke about. Non-stratified squamous, non-keratinized epithelium is what you have to draw on the rest of the circumvallate papilla. Okay, so the key feature here is this groove between the two, which forms, they are called the lateral walls of the circumvallate papilla, 1 and 2. Between the two, this is one circumvallate papilla, this is another circumvallate papilla. So the taste buds kind of face each other, correct? Okay, adjacent walls. So this is how you draw a diagram of the tongue. Now, ideally, what should happen is you can draw all three in the same one, okay? Filiform, fungiform, and circumvallate, all three in the same one. Draw one of each, two of one, whatever, and then draw everything else that comes in, and then your tongue diagram is done. That's it, okay? This much if you draw, you will easily score a good number of marks, okay? Now, I am going to quickly take you to a better diagram. This is what our illustrators have drawn, right? If you look at this here, let's just quickly go over it, okay? Here you have the filiform papilla. Sorry. Filiform papilla, fungiform papilla. You can see a taste bud here. Here you have the circumvallate papilla. The taste buds are on the wall, on the lateral walls, right? You see the epithelium. This is keratin. There is no keratin here. Filiform has keratin, fungiform has no keratin. Next come this is the lamina propria. Again, it's not a fold. You have to use the word elevation. Elevation from the surface, okay? What else do you see? We see skeletal muscle. This is the LS. And then you see skeletal muscle, which is TS. transverse section, longitudinal section. Here you have a bunch of seromucous glands. This is the mucous gland. This is the serous gland. And then this is the epithelium, which continues down. No papilla here. This is the what's that? Ventral surface, dorsal surface, right? Done. Now, a quick way to revise what this session all had is mind maps are very handy in revising. We already spoke about this. Posterior 1/3, anterior 2/3. I already told you mucous membrane means lamina, propria, and epithelium. Please do remember this formula. And then you have upward projections on the mucosa. What about the different types of papillae? We spoke about it. And then we spoke about the glands. Yes, the serous glands are also called as von Ebner's gland. I think this is a neat question. It's also a Viva question. So you have to remember the serous glands of the tongue. The other name for it is von Ebner's glands. Other than that, you have mucous glands. Now, let's come to the taste bud, okay? I'll make it quick. Let's say this. This is the taste bud. Okay. Elongated cells with elongated nuclei. Now here, what is the main role of it? It has to carry taste sensations, right? Now the cells that participate in this sensation of taste are called gustatory cells. Okay? But you also have cells that do not participate in this, but you need them because they provide support, and those are called supporting cells. Other than this, you have basal cells. Okay, so these are called basal cells, right? This is about your taste bud. Okay, so that quickly finishes up the revision of tongue. Let's go back. Next is cartilage, right? Now this is all basic stuff, okay? So let's have a back and forth. What is cartilage? Connective tissue, right? Cartilage, how is it different from bone? Anyone? I think it's just too much to type, so maybe you can just unmute yourself and tell me. Softer, yes. It's more pliable, right? Bone is like hard, dense tissue. Okay, we will come to bone also after this. So in general, if you see, connective tissue is divided into like a generalized connective tissue, and then you have a special connective tissue. Generalized connective tissue can be your loose areolar tissue, fat cells, wherever certain areas require a lot of fat. So those are called adipose tissues. But specialized connective tissue is in areas where they have a very specific function. And in this, the three main types are cartilage, the other two are bone and blood. Okay, in this session, we will only do cartilage and compact bone, one type of bone. Okay, now cartilage, yes, more collagen fiber, correct. Actually, there's more calcium salts also in bone, which is actually what gives it its rigid structure. Okay, mineralized, right? Okay. So if you take a step back and the question says hyaline cartilage, take one step back, define what is a cartilage, right? You will say cartilage is part of the skeletal system. It is a specialized connective tissue. Definition, we'll define it. There are three types: hyaline cartilage, elastic cartilage, reticular cartilage. White fibrocartilage. Now, I have heard examiners ask this question: what is the difference? What is yellow fibrocartilage? Can anybody tell me have you heard of a yellow fibrocartilage? Does anyone know what a yellow fibrous cartilage is? No? Okay, so the yellow is also called elastic cartilage. Okay? And then you have the white fibro. So if you have anybody ask you what is the yellow fibrocartilage, now you know elastic cartilage is also called yellow fibrocartilage. Okay? Now, this has a very, if you watch our video on cartilage, I have used a very interesting analogy here. Okay? And this is how I was taught how to remember connective tissue. I was taught to remember soup. Why soup? How do you make soup? Okay, first of all, you need, okay, how do you serve soup? First of all, you need a bowl, right? Now, the bowl is that what contains your soup. So, covering of the cartilage can be compared to the bowl, which is called, in this case, perichondrium. Covering of cartilage is called the perichondrium. Okay. See, all of them are called peri only, right? Peri, epi, right? So if it's bone, it is called periosteum. If it is cartilage, it is called perichondrium. If it is nerve, it is called perineurium. If it is muscle, it is perimysium, right? But the prefix peri remains the same. Okay? So let's say your perichondrium is the bowl. Now, inside that bowl, when you want to make the soup, first thing you need is you need a medium in which everything else can be, right? You want to add vegetables and meat and all that, but that's not going to make soup. You need something that is kind of like a liquid, right? Like a gel-like liquid, if it's a thick soup. So let's say your medium to make the soup is the matrix, whatever. Okay, or it's called the ground substance. The medium in which all the other components float in, you could say, is called the ground substance or the matrix. This is your stock, vegetable stock, chicken stock, water. Next, you will add vegetables. Now, I was taught, this is how you remember, vegetables are fibrous foods, which means you require fiber. So what are the three fibers? Collagen fiber, elastic fiber, reticular fiber. Yes. Okay. This is all what the fibers do, what are the fibers? This is all dealt in connective tissue. Next, you want to add some protein, right? Now, if you're a non-vegetarian, you might add meat, of fish, meat, whatever. Or if you're a vegetarian, you'd probably add like paneer or tofu or, some tofu, I think tofu's protein, right? Soya chunks. I think that's also protein. Okay. That means number 4 is proteins or cells. Okay. Now, because it is cartilage, and I told you, right, chondro is the word that you use to depict cartilage, which means if it is a cartilaginous cell, they are called as chondrocytes, right? These are so this is the outline. Okay, now if I have to study cartilage, I will first think of the soup bowl, perichondrium. Now I will think about perichondrium in hyaline, perichondrium in elastic, perichondrium in white fibro. Then I go to the medium, ground substance. How is the ground substance in hyaline, elastic, white fibro? Study them together. Then only you will remember what it does. When you know what it does, you know where to find it in the body. And this is a common question. Where do you find this cartilage in the body, right? Then you will not forget it, okay? Next, coming to fibers and then coming to cells. So based on how much fiber is required, okay, for example, if there is a lot of collagen fiber, that means it is increased tensile strength, right? This is a characteristic feature of hyaline, okay, and white fiber also actually. Okay, but elastic, on the other hand, as the name suggests, it needs to be pliable, it needs to move easily. I can move the tip of my nose. I can squeeze my ears because they are all made up of elastic cartilage, right? Which means the fiber that has to be in an elastic cartilage is predominantly an elastic fiber. Okay. Now let's draw all three together. Okay. I'm going to make 3 circles. Oops. Small circle. Circle, circle, circle. Right? Now this one is going to be hyaline, this one is going to be elastic, and this one is going to be the white fibro. Okay. First, the soup bowl, perichondrium. Now you remember that the white fibrocartilage is so abundant with fibrous tissue or fibers, collagen bundles and bundles of fiber, that you can't even actually make out the difference where that boundary is. Okay. It kind of merges with connective tissue outside the cartilage, which means what I'm trying to say is that white fibrocartilage does not have a perichondrium. So what is this? This does not have a perichondrium. Okay. Right. Now, and um, elastic and hyaline cartilage do have perichondriums and they are similar. Now, perichondrium has an outer layer which is fibrous. So, outer fibrous layer, and then an inner cellular layer. What is this cellular layer actually? These are nothing but chondrocytes itself. Where are these chondrocytes coming from? They're coming actually from the center. So if you have hyaline cartilage here, as the cells go to the corner, they become smaller and flatter, and then they line this area. Okay, so that forms the cellular layer of the perichondrium. Always, if you have flat cells, you will have a flatter nucleus, slightly. Okay. Right. And here you have some of these cells are also here in the fibrous layer. Some nerve cells. Nerve cells, blood cells. Do you have nerve cells and blood cells in cartilage? Does anybody know this answer to this? You know why osteoarthritis? You know why I'm sure you have people in the family who have arthritic knees and things like that. And we call it a degenerative disorder, something that cannot reverse itself. Once you have bad knees, you have bad knees. You either have to replace the knee altogether, or it cannot reverse, cannot repair. Cartilage does not repair itself. And why is this? Because it does not have blood supply. Okay, so where does it get its blood supply from? I'll tell you. Okay, now, so this is now, okay, first let's do perichondrium. No perichondrium in one, perichondrium in the other two. I've already told you perichondrium has outer fibrous, inner cellular. Okay, now let's get into what's next, the medium in which all your other things are floating around. Okay, this medium, okay, this might be slightly messy now and I might come out of the lines. Please excuse me. What you need to do in hyaline cartilage is you need to make the entire substance of it slightly bluish. You're anyway using your H&E pencils, right? So you make the entire thing slightly bluish because the fibers are scattered, and so they don't actually take up stain, which is why it has a very glassy look. In fact, it is called hyaline because hyalos, meaning glass. Okay, because it looks very glassy, it is called hyalos. It has fewer cells. Okay, and these cells are not arranged individually mostly. See, there is no hard and fast rule here, but in as you can say as a rule of thumb, the cells are arranged together like this. Why does this happen? I'll tell you. If this is a parent cell now divides into two, or these will further divide. And what happens is these cells don't separate from each other. It's like a little family, Yes, thank you, Faisal. It's called a cell nest. You know how we say all when you have nuclear families, it's like you having your own little nest, right? So when the parent cells divide, they all stick together there. And this is called a cell nest. A cluster of chondrocytes in hyaline cartilage is called a cell nest. All right? Chondrocytes, okay? So again, you can draw a few of these like this. They don't have to be sets of 4, they can be sets of 2, sets of 3, and they are fewer. Okay. Now the matrix I told you, right? Now, if you look at this matrix is slightly bluish, correct? This is all in between these cells, right? So it is called interstitial matrix because it's in between clusters or in between. But what happens is the area immediately around it also picks up a slightly darker stain, hematoxylin stain, okay? And that is called, now it's a nest. Now every little home has its boundary or its territory, which is why it gets the name territorial matrix. Okay? If you do this much, hyaline cartilage is done. Now, when you go to the elastic cartilage, we already know that the ground substance here takes up a little, it has less fiber. So you don't draw too many fibers. You just draw the nest, cell nests, and then you just draw the 2 types of matrix and you perichondrium. But here what happens is most often these elastic fibers, cells are isolated. Sometimes they can be in clusters, but most often they're like this. Some books will tell you that the cells are actually also larger. But the characteristic feature of this particular cartilage is the elastic fibers, okay? Elastic fibers, we know, they do not run in bundles. They're singular fibers like this, elastic, wavy. So all you have to do is draw some waves in between this way. Like I told you, I promise I'll show you better diagrams. And that's it. This is your elastic cartilage. Where do you find hyaline cartilage? Where you require strength, right? Or where you require shock absorbing capacity. I spoke about arthritis. So that means things between joints. The articular cartilage of joints is an example of hyaline cartilage. Okay. Elastic cartilage, wherever you want to move. Yes, IV disc is an example. Elastic cartilage, wherever you want to move. So you can remember, I think there's a mnemonic here that says E, E, and E. E for elastic, E for ear, E for the eustachian tube, and then another E is the epiglottis. So E, 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 all 4 E's, okay? Next, we'll come to so this is done. Elastic cartilage is also done, okay? This is a comparative study, guys, so that you can remember it. Now, next we come to the white fibrocartilage. Soup bowl, no soup bowl. This cartilage is like, like a troop that does not need a leader. I'll eat straight out of the soup pot itself. I don't need a bowl to serve, okay? But it is very, very rich in fibers, okay? And these fibers, because it requires, it requires great amount of strength. What happens is these fibers, they run in collagen bundles like these. So you draw bundles of collagen running this way. And these bundles of collagen run parallel to each other, okay? Fibers run parallel to each other. So you can draw it this way. And then, so vegetables are done in your soup. What do you need next? You need protein. So you need cells. Cells here are also quite interesting and unique, right? The cells here are arranged in rows. You see? Cells are also arranged in rows. So you fill up this entire thing with your fibers, whole thing. And in between that, you draw your cells and draw your cells in rows. All right. Nucleus, nucleus, please don't forget your nuclei. White fibrocartilage. All right. Any doubts, guys? Was this an easy way to study the three different types of cartilage? I hope it was. This is how I studied it. I hope it was very helpful when I studied it this way. I hope it's helpful to you as well. Now, let's open better diagrams. See, I have put some cute little elements here so that you remember. Soup, medium fiber cells. Okay, always remember this and you will never forget cartilage. What is perichondrium? Is the covering. This is now I'm revising. Okay, so first we have hyaline cartilage. Here in this mind map, it clearly has shown what are the features of the ground substance. I mentioned territorial matrix and the interstitial matrix. I also told you it is homogeneous appearance, so it looks kind of like glass, which is why it gets its name. Hyalos means glass. Perichondrium it has an outer fibrous layer, inner cellular layer. Predominantly fibers are collagen fibers. I've put a broccoli here to remember. Cells I could not find a vegetarian source of, I could not find a vegetarian picture, so I've just put some meat there. And yeah, so clusters of 2 or more, cell nests, remember this. Boundary of this nest, remember to just shade a little in blue. And this is called your territorial matrix. Now, what are the examples? This is very, very costal cartilages. That what is costal cartilages? You have the central bone of the chest. It's also called the breastbone. It's called the sternum. And to that, you have the ribs that come and attach. Okay. So that just before it attaches, a small part of it is cartilage. The rest of it is bone, flat bone, but a small part of it is cartilage. And those costal cartilages is made up of hyaline cartilage. Okay. Also, I told you joints, TMJ, knee joint, shoulder joint, all these articular cartilages is also hyaline cartilage. Now here, articular cartilage is an exception, okay? Because articular cartilage doesn't have perichondrium because all these are synovial joints, right? If they are synovial joints, meaning it has to have a fluid to lubricate the joint because you're moving it, right? All the time. Every time you're walking, sitting, jumping, running, you're moving your knee joint. You need a lubricant. That lubricant is called a synovial fluid, which is also rich with nutrients. And that nutrients actually supplies the cartilage. So it doesn't have a perichondrium because all the nutrition comes from there. And it doesn't have blood vessels, obviously, right? Cartilage doesn't have blood vessels. Okay, so all nutrition to the cartilage happens by diffusion. Okay, even inside the hyaline cartilage, to the cells also, right? It's from this matrix itself that diffusion takes place and nourishes the cell. How else? If a cell does not get nourishment, it will die, correct? Which is actually one of the things that happens in degenerative disorders is that the cartilage starts wearing off, tearing off. It takes years to happen. And then eventually you lose more and more cartilage. And this is very painful. Cartilage doesn't even have nerves, which means even if you hit a cartilage or whatever, or a cartilage is damaged, it doesn't actually cause any pain. What causes pain in arthritis is when the two lining cartilages wear and tear and are gone. Then what happens? The surface of the bone starts rubbing. And that surface of the bone is very, very sensitive. So that is what causes the pain, not the cartilage itself. All right. Okay. This is the diagram of white fibrocartilage. As I've already told you, draw a lot of collagen fibers running in bundles, and you see chondrocytes are arranged in rows and they're all interspersed within, okay? Perichondrium is absent. Most abundant component of this is the collagen fiber. It's type 1 collagen. This is actually also a difference between the collagen in fibrocartilage and collagen in hyaline cartilage differs because in white fibrocartilage, you have type 1 collagen, okay? And what else? So to remember examples, you can remember all your midline structures. Manubrium sternal, which means manubrium is the first part of the sternum. And then you have the body of the sternum. So where the manubrium joins the body is called the manubrium sternal joint. So actually all these joints, right, symphysis, they're called, okay, where one half from left side and right side come together in the midline and then they form a joint. So these joints in the midline are examples, but they don't join directly. They have a thin plate of cartilage in between, and that thin plate of cartilage is the white fibrocartilage, okay? And somebody also said, yeah, IV discs, that's also a correct example. Then in the knee joint, you have these two semicircular, semi-lunar type of caps that sit over the tibia. Tibia is your shin bone. You know, if you really kick somebody in the shin, that's the bone. It's super sensitive because it's right under the skin. On top of that, these two meniscus sit. And then you have the femur, which is the bone of the thigh that sits over it. And that cartilage is a shock absorber and it allows easy, free, non-frictional movement, okay? That meniscus is also an example of white fibrocartilage. Then we have yellow fibrocartilage, which I already told you, elastic cartilage. You learned something new today. Perichondrium, just like hyaline cartilage, lots of elastic fibers loosely running all over the place. Lot of cells. If you see, they are not arranged in bundles. Mostly they run loosely, right? And this is seen. Examples, E. I've written only ear and epiglottis here. Another one is the eustachian tube, which is your auditory tube. Not the whole, not all of it, part of it, right? Okay, cartilage done. Easy, I hope it was easy. Next, we're going to bone. This is the last one of today. Okay. Bone. Bone is also connective tissue. Bone is the hardest connective tissue, the most rigid connective tissue, right? Now, how does bone form? There's a process called ossification, okay? Now, what happens is actually there is something called woven bone. You know, anything woven is endochondral or intramembranous, whichever, right? Two types of ossifications can happen. Flat bones usually are like your skull bones and things are intramembranous ossification. Most of your long bones are endochondral ossification. But every bone, like your long bones, have both these parts. Okay, I was talking about woven bone. So woven bone is something, let's say, weaving, okay? It is not tightly packed. It's kind of like a loose weave. If you're putting together a sweater, I don't know anything about knitting and crochet and all, but I've seen people do it, that it's kind of see-through, right? It's see-through because it has spaces in between. So initially what happens is ossification happens and woven bone is formed, okay? But woven bone, one thing is it happens very fast. It's a very quick process. Anything that is too quick, possibly not the best process, right? And it is not very strong. It lacks strength. So then what happens is I compare it to like a cling wrap, you know. If you put a cling wrap around, say, a toilet tissue or something, this is how I used to teach my students. I take a roll, not really toilet tissue, but that kitchen roll has like an elongated cardboard piece inside, circular, cylindrical piece. And you put cling wrap around it. If I put just one or two layers, it's easy to rip apart, right? But imagine something as flimsy and delicate as a cling wrap. If I take it round and round and round in layers, tight, very tightly packed layer after layer after layer, finally, when I have a thick padding around that cylinder, it's not possible to pull it apart. Is possible, but it's a lot harder. It is because just by layering it, I have drastically increased its strength. And this is what happens when lamellae means layers, okay, start arranging themselves in concentric circles. It gives the bone tensile strength. Now here I'm talking about compact bone, which is why it's called compact bone. It's also called cortical bone. Now the reason I'm doing only this, there is another trabecular bone which kind of looks like a sponge, exactly like a sponge, because it's actually very porous and it's filled with bone marrow. So it's on the inner side of the bone, inside. If you've seen a structure of a bone, like what is, I think it's called nulli or something. Okay, I think it's called nulli. This is actually bone marrow that you see in long bones. Okay, that the outer part of the bone is compact because that part should be strong. As you go in, you have a layer of the spongy bone, trabecular bone, and then you have a space inside, like a cavity, which is called the marrow cavity, right? So bone, this part is called compact bone. Here inside, you have the marrow cavity. And here, this part is called the trabecular bone. This is not in the entire bone, okay? Not throughout, okay? Now, when you have a question that will come for your exam saying, draw a diagram and explain TS of bone or compact bone or cortical bone, this is what you have to draw. Now, if I take a section of this bone like this, okay, it will look rounded, right? With the marrow cavity inside. Now, let's study this portion like a slice of cake. Okay, this is what I'm going to now enlarge and tell you, which means you have, I'll make a circle. Okay, this is how you'll draw it in your exam also, okay? Which means inside, here you have marrow cavity, right? This is lined by endosteum, a lining. Remember we said endochondrium, perichondrium, all that? And the outer surface of the bone will be lined by the periosteum and the endosteum lining, okay? Now, just like how the perichondrium had an outer fibrous layer, inner cellular layer, similarly, even the periosteum and endosteum has the similar stuff, okay? So when you draw it, you draw an outer fibrous layer and an inner cellular layer. All right? Nucleus, nucleus, nucleus. Now listen, periosteum, it has a rich nerve supply, which is why it is actually considered to be the most sensitive part of the bone. In fact, dentists also know this because when your syringes hit bone, they say that patient says it is far more painful than the pain of the actual procedure itself. Please feel free to challenge me on this. I'm not a dentist, so. Okay, this is the periosteum, outer fibrous layer, inner cellular layer. Now, I told you that to make the bone very hard and rigid, what happens is there is a lamellar concentric circles or a lamellar arrangement, okay? So this is around something called, now this is how you will draw it. First, you draw central canals, okay? One. central canal. It's also called Haversian canal. Okay, what does this Haversian canal have? This is your long bone, right? This is the long bone. Okay, these canals run along the length of the bone. Okay, why? Because they are the ones who transmit the blood vessels. Okay, which means you will draw one artery, one vein, and one nerve, and lymphatics also. Okay, so everywhere when you draw one artery, one vein, one nerve, right? Haversian canal. Now, around these Haversian canals, you have a concentric arrangement of which cell? Anybody can tell me which cell will be concentrically arranged around the central canal. What is the cell, a mature bone cell called? A mature bone cell. Osteocytes, that's right. Okay. So these osteocytes, right? See, this is an osteocyte. These osteocytes are actually inside a lacuna. Lacuna is like, it's like saying it has its own cabin. Okay. Osteocytes are like the mature boss cells and they have their own cabins. Okay. They don't share any space with anybody. So this is called a lacuna. And these are called osteocytes. Okay. Now these osteocytes have processes radiating out from them. This is an osteocyte. So when you are drawing your diagram, what you will do is you will draw these osteocytes like this around it in a concentric layer. Okay. Now the key feature of these osteocytes is, I told you they are the bosses, which means all communication between departments has to be done by these osteocytes. Okay. They're actually they're mature cells, but they're very, very important cells. So what happens is when you draw these processes, you have to ensure that the processes are actually touching processes of adjacent osteocytes. See what I'm doing here? They are all communicating. Why does it do that? Because it has to mediate a lot of processes that is happening. Either the bone has to grow, or bone has to remodel, or maybe there's an injury and the process has to start all over again. All these processes are mediated by these guys. Okay. Now these osteocyte, and this is called canaliculi. Okay. So canaliculi, it's like shaking hands with everybody in the department and getting the work done, is where they are constantly telling them, okay, this is required, that is required, or nutrients have to be passed on from one place to another, because you see this Haversian system is bringing it in here, but after that the cells have to be nourished, right? So even nourishment passes through these canaliculi. Okay. Now what has to happen now? This same process, right? So you when you draw a few more, okay? Not just this many. Draw a few more like this. And then here also. And then here also, same thing. Haversian canal. What is the functional unit of a bone, of a compact bone? Again, another formula. A Haversian canal plus these lamellae equals Osteon. This is an important word which you have to remember. Yes, osteon. Okay. What is the other name for osteon? Remember the first thing in the formula here. What is the other name for an osteon? Anybody? Haversian system. Correct. So an osteon is also called a Haversian system. So this is a very important Viva question. They will ask you, what is an osteon, right? So an osteon is the functional unit of a compact bone. And it comprises a central canal or a Haversian canal, around which there is concentric lamellae. Okay, this is what is the definition of an osteon. Right. Now, so this is done. We finished the periosteum and we finished this part. Now look at this diagram, okay? Now I told you they run longitudinally, right? So let's say I've cut the bone this way, and this is your Haversian canal, okay? Multiple Haversian canals are there in your compact bone. And the blood vessels and nerves are running along the length of the bone, around which I told you these concentric lamellae will have to be there, okay? Now, where is this blood coming from? What is supplying this Haversian system? It's coming from the periosteum. Okay, the periosteum sends the vessels and nerves into the bone. It enters the Haversian system. And then these adjacent Haversian system, right? Haversian canals, sorry, will communicate with each other through something called, can anybody tell me what does this V and C stand for?
Waxman canal.
Volkmann's canals, correct. Now, because they are perforating through the substance of the bone, or they are actually poking through where they, through it, it is also called as a perforating canal. Okay, so the two different names for it is perforating canal, Volkmann's canals. Okay, this also has the same thing. Whatever the Haversian canal has, artery, vein, nerve, this one will also have the same thing. Okay, artery, vein, nerve. And this is how all the communication is happening. So if you get the question, and this is a repetitive question, at least someone told me that once in 2 to 3 years, it's a 4-mark question. This is all you have to draw. You have to draw, and then you make a connection here between two of them and say Volkmann's canals. Okay. Now, one last thing I have to tell you about the lamellae. There are 3 different types of lamellae, and this is very sensibly named based on where you find it. Okay. One is making a circumference around the Haversian canal. So it is called circumferential lamellae. Sorry. No, that's not what it's called. This is called, it's in concentric circles. So this one is called the concentric lamellae. Concentric, because they are making concentric circles. What is circumferential lamellae? Circumferential lamellae is that which lines the bone itself, circumference of the bone, okay? So this osteocytes, right? Once you finish making concentric ones, what you will also do is you will continue this process in between, and also you will make them communicate with each other like this. So one recommendation, when you draw your first circle, don't draw it too huge. Otherwise, you'll be stuck completing that circle, okay? So my approach to histology is I first draw the diagram. I list out all the things that have to come in my diagram. And the answer after that is just points on what I see in my diagram. Because anyway, what I don't see in my diagram is probably something I don't know anyway. So just to save time there, I learn the diagram well before I go. Okay? Correct. Concentric lamellae. This one here that is around the circumference of the bone itself is called circumferential lamellae. Now, this depends. If it's on the outer surface, it's called outer circumferential lamellae. If it is on the inner surface, it is called inner circumferential lamellae. Okay? Another lamellae, of course, that you see is in between the two here. In between, there is one osteon here, there is one osteon here. The one in between osteons is called, anybody remember I used the word in Hyaline also? The matrix that is in between the cell nest is called interstitial matrix, right? In between. Interstitial is in between, it's occupying wherever there is space in between stuff. So this lamellae that you see in between is called the interstitial lamella. If you have put this much in your paper, you have aced it, believe me. Okay? Now I'll show you a good diagram of it, and this is the last. Right. This is a very, very nice mind map. Oh, this is what I was talking about. If you can see this, again, illustrated by our own illustrators, beautiful diagram. See, this is the periosteum. What they have done here is I've peeled it off the bone. You know, it's like a layer. You peel off the periosteum. And here you have, this is one osteon, another osteon. In between these osteons is what you can find the interstitial lamellae, interstitial. Here you find concentric lamellae of osteocytes, canaliculi, all that you have to draw. And this here is the circumferential lamellae, right? Here, this portion is called the Haversian canal. And here, when two Haversian canals, adjacent Haversian canals, communicate with each other through the Volkmann's canals. All right. Okay. See, this is how an osteon looks. I told you it is layers and layers and layers just to make it very, very compactly rigid, strong. Bone has to be strong, isn't it? Compact bone is strong. Okay. And this is actually how the Haversian canal is, you know. See, this is what I mean by concentric, one inside the other, you see? This, if you remove it like cup in a cup. And here you have the osteocytes, canaliculi. This is an osteon. Beautiful. This is a great diagram. This is how your diagram has to look. Okay? It's got everything here. I've covered all this, actually. I've covered all this. This is an osteocyte sitting inside its lacuna. One single osteocyte with its canaliculi. All right. So that was it about this session. Quick diagrams, how to draw your diagrams, how to remember, and that's it. We're done. Anybody has to say anything? Ask anything? Was this a good session, guys? Was it helpful? Helpful session? Yes? Okay. That's it.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.